as a country, we spend more on healthcare than the next 10 top spending countries combined, yet we're the sickest with the shortest lifespan of all industrialized nations. So it's really the height of arrogance to then call something woo woo because it's like the failing student, like shaming the valedictorian of us actually getting people healthy.
I can shoot a drug into your IV that will, say, have some result. And if the goal is to lower blood pressure, the quickest way to actually lower your blood pressure is to take 10 deep breaths, is it not?
Mm-hmm. Yeah.
So for folks, when, and the concept, I'm using breath because you mentioned it, and someone, I was having a conversation, not about this book, but it was a similar topic. It was, and they were like, yeah, but, and I'm like, whoa, we gotta, breathing is a way of regulating this body that we're given. And if you can, if you're stressing out, you can even just look at a piece of paper that tells you when you're stressed out, do these 3 things, because you have forgotten or you're not in a position to recognize it yourself. See the diagram, maybe write it on your hand, like take 10 deep breaths. That is what we have called woo-woo, has its basis in science, and just so happens that you can actually experientially, you can get the benefit immediately if you actually did it. You sit down and you measure your blood pressure before you take 10 breaths, and then you measure it after. It's going to be lower, right?
Yeah, exactly. And really, science is catching up with antiquity. Like what was seen as like it's really just us as a culture and the height of hubris that we forgot what humans knew intuitively for thousands of years. Somehow we got divorced, and there's this collective amnesia that we forgot. Like humans didn't need randomized controlled trials. They just knew when they went out in nature that there was this meditative sort of connection, and it felt good. It was good for their health. They lived in nature. But now we live this sort of sterilized life that, again, this evolutionary mismatch, that now there is randomized controlled trials that looks at things like what we call forest bathing, because it comes from the Japanese phrase Shinrin Yoku, which translates to English as forest bathing, but it's using nature as a medicine, using nature as a meditation that our ancestors didn't know the mechanisms. They didn't have a fancy name for it. They just called it life. But now we do have science. For people that need the science, there actually is science here. That's just one tool that I talk about in the book. But breath work, there's so much science around it. I mean, look, the Cleveland Clinic has a functional medicine center, and the Institute for Functional Medicine is who's trained all the doctors there, and myself and my team. So this is not, I think it's really archaic, and that sort of old sort of like tribalism, I think, within healthcare, that it's woo-woo or fringe or quackery to do anything other than just take this medication. I really feel like that age is gone. There's still people clinging to it, but ultimately, people want to know what's your most effective option that causes you the least amount of side effects. And look, for some people, medications are going to be that and they need to be on it. But there's a lot of tools that researchers are looking at that really have no side effects and are very effective. And most of them are free or low cost. So I think that the whole calling things woo woo and quackery is a way to shut people up, because it's this virtue signaling. It's I'm an elitist and you're somehow, less than me. But I don't think that that's cutting it for the average person out there that really just wants results. And I think the statistics speak for itself, because as a country, we spend more on healthcare than the next 10 top spending countries combined, yet we're the sickest with the shortest lifespan of all industrialized nations. So it's really the height of arrogance to then call something woo woo because it's like the failing student, like shaming the valedictorian of us actually getting people healthy.
I'm going to use that as the opening to the show. That's just too good, because that's like that to me, and recognizing it as hubris is, I think it's spot on. That's like a laser beam to the truth right there. All these things that we have historically, shunned for all various reasons. The healthcare industry, not alone in that, but certainly a major player. Like, it's time we shape up. To that end, and going specifically into the book now, I'll just say it again. It's gut feelings. Um, we've talked a little bit about the chronic stress part and diet. We focused on sugar, but there are others. You mentioned, but I'd like to sort of revisit unresolved trauma. So I'm going to put a pin in that for a second. But well, actually, let's do unresolved trauma. But I also want to talk about toxic productivity. So unresolved trauma, we talked about the connection there to the dysregulated nervous system, but that it can also be intergenerational. Um, I would say I speak to of the anyone I'm willing to have a or who's willing to have a conversation like this with me about this kind of stuff. I would say 9 out of 10, and this is across gender, across race, socioeconomic. 9 out of 10 would say they're stressed out. Also, 9 out of 10, this is again anecdotal, my experience, would say, but my trauma is it's the same as everybody else's. It's like, and there,
Mhm.
to be fair, there are people who have suffered trauma that they identify with. But I'm really interested in this conversation with you about the sort of the sneaky trauma
Mhm.
that what I would say that everyone has. I'm
Mhm.
wondering if you can comment on that.
Yeah. And it's one of the top things that we talk about when I'm having an initial telehealth consult. And I talk about it in the book because of that, that these things that we almost people will gaslight themselves. They'll say, well, they'll know other people that have gone through worse. So they'll say, yeah, it's like it's not as bad as them. So therefore it's not that big of a deal. But research is clear. I mean, one of the things we have patients fill out is an ACE questionnaire. I talk about it in the book, but it stands for Adverse Childhood Experience. And the higher your ACE score, research shows you're more likely to have something like a metabolic issue, diabetes, insulin resistance, weight loss resistance. You may increase risk of autoimmune problems, increased risk of things like IBS, like digestive problems, increased risk of hypervigilant nervous system like anxiety, depression, etc. So the questions within the ACE questionnaire are things like: was there sexual abuse as a child? Was there physical abuse growing up? Was there substance abuse in the home? Was there mental illness in the home growing up? Was there just neglect? I see a lot of what they call like latchkey kids. Like they went home and the parents, they had a nice, relatively nice childhood. Their parents loved them, but they had to fend for themselves, and there was a lot of like not a lot of nurturing growing up. That is an ingredient within the confluence of factors. Is it the only variable to consider? No, but it is certainly a piece of the puzzle for many people, and for some people it's a big piece of the puzzle. So if you've dealt with all the other pieces of the puzzle but you haven't looked at that one. Those are the areas, those are the dark corners that I really wanted to talk about in the book, because I see those are the linchpins for many people to like move past that plateau. Like they're better off than they are if they like they're doing the nutrition stuff, they're doing exercising, but they don't realize that that thing that they've gaslit themselves over is actually a piece to their health puzzle, not the only piece, but a piece. So yeah, it is a massive issue, and we know it's stored in the body. It's our body is a cellular library, and our thoughts, like how we speak to ourselves, our words, our experiences from our past, are the books that fill up that cellular library, and it impacts things like methylation, which is impacts how inflammation is expressed. It impacts how your nervous system is regulated.